So you might be wondering, Henry, that's a pretty small unit. Can it still take care of me like everyone else? First of all, it's average. Second of all, this mobile intensive care unit has the capabilities of any other ambulance, just in a smaller, more compact design, which I can show you right now. Starting from the outside, we have our extrication equipment, including backboards and long bone splints. Additional extrication supplies, including the KED and C-spine stabilization, are located right here in the side. Airway devices, including the CPAP, non-rebreathers, nebulizers, and nasal cannulas, are located in this compartment. For invasive procedures, we have our EZ-IO, video laryngoscope, ventilator, vent circuits, and IV pump. Below that, we have our stair chair, mobile suction device, medication bag, and airway management bag. In the action area, we have gloves, patient wristbands, protocol binder, wall-mounted suction, wall-mounted oxygen, trash that I need to empty, and miscellaneous supplies. In our B cabinet is mostly trauma supplies with cold packs, hot packs, sterile 4x4s, SAM splint, non-sterile 4x4s, eye wash, pressure infusion bag, suction catheters, pelvic binder, arm board, pink slips but they're actually orange, cat tourniquet, petroleum gauze, triangular bandages, band-aids, and rolled gauze. The A cabinet contains a lot of stuff, mostly PPE and body isolation gear, but we also have psychiatric restraints, sterile water, trash bags, biohazard bags, a bunch of N95s, surgical masks, emesis bags, flashlight, manual blood pressure cuffs, and a PD mate for small patients. At the back of the ambulance now we have our main oxygen supply, which gives oxygen to the wall outlets, and our man sack along with a fire extinguisher. Opening up the back of the ambulance, we can see our extra linens, extra portable oxygen container, sanitation wipes, and stat pack. The stat pack is basically the bag you take in on every call to have supplies in case of most emergencies. If you need additional supplies, we just run back out to the truck and grab them. Below the bench seat, we have our Lucas device. Not in the typical packaging, we use this backpack to save space. This machine does automatic CPR compressions, and it's literally a lifesaver. Every seating position in the ambulance is fitted with seat belts, including these ones on the bench seat, which stretch out a lot to make it easy to access supplies and the patient. And speaking of the patient, it wouldn't be an ambulance without a stretcher. The stretcher is obviously where the patient sits. We have shoulder restraints, lap restraints, and feet restraints, a portable oxygen canister, the monitor complete with defib pads, end tidal monitoring tubes, EKG stickers, 12-lead equipment, glucometer, blood pressure cuff, and pulse ox. At the back of the stretcher, we have an extra sheet, an extra man sack, an inflatable splint, and a C-collar underneath. Making our way back around to where we started, we have our cargo netting, which we use for stethoscopes and occasionally hanging up other supplies, and additional sanitation supplies down here. If you guys enjoyed that speed run of an ambulance tour, or you want to know more about some of the equipment or supplies that I talked about, be sure to leave a like and a comment, and follow for more EMS content. Thanks.